Hi, I'm Isabel Boyles, and my topic is how to survive living with anxiety and type 2 diabetes. So, I just wanted to start my presentation with a brief overview of what I'm going to be talking about. The first thing that I'm going to go over is how prevalent the comorbidity between anxiety and type 2 diabetes is. Because this is talking about how anxiety and type 2 diabetes relate, I thought it would be really important to look at the comorbidity between the two. The next thing I'm going to discuss is the relationship between type 2 diabetes and anxiety. And then I'm going to go over how anxiety can impact someone living with type 2 diabetes. And then lastly, how to manage anxiety and type 2 diabetes. And then just a conclusion and a list of my sources. Okay, so to begin, how prevalent is the comorbidity between anxiety and type 2 diabetes? So, my research found that the lifetime prevalence of anxiety disorders is roughly 7.3%. A study conducted by Dos Santos concluded that adults living with type 2 diabetes have higher rates of panic disorder, generalized anxiety disorder, and obsessive compulsive disorder than those living without type 2 diabetes. So, this kind of shows that there is a big comorbidity between all anxiety disorders, but the main one that I found was generalized anxiety disorder relevant to type 2 diabetes. And then another study conducted by Lee found that adults living with type 2 diabetes had a higher overall prevalence of lifetime anxiety by 20% than those without type 2 diabetes. So, what is the relationship between anxiety and type 2 diabetes? So, like I just mentioned, the comorbidity between anxiety and type 2 diabetes is very high. This comorbidity could be due to unhealthy self care, pain, medical and personal complications, depression, and someone's BMI. So when you think about it, if you're in pain, like really, really in pain, you're constantly going to be thinking about it and worrying about it, such as worrying about how you got hurt, or worried about how you're going to pay to get better, or what could be wrong with you. And that can cause a lot of stress. So for individuals living with type 2 diabetes, if they're constantly worried about their pain, then their blood sugar levels can change. And I'm going to talk about that in a little bit. And then, similar to pain, medical complications that can be something like pain or medication not working for diabetes, or you get sick from your medication, or something along those lines. And then, personal complications. So, I chose to do this project because my stepfather is living with type 2 diabetes, and I have seen how when my stepbrothers are not behaving or something, they're doing something that they probably shouldn't be doing, my stepfather gets really anxious. And then at the end of the day, regardless of what he ate or how he acted during the day, his blood sugar levels are typically really high. So there really is a comorbidity between his anxiety and his diabetes. And I just chose this topic because I kind of wanted to learn more about it and maybe find a way to help him. But I really don't know if I can. Um, so, anxiety causes stress, which can impact blood sugar levels, making it harder to monitor one's blood sugar. Stress hormones can also prevent insulin producing cells located in the pancreas from functioning properly. So, the pancreas targets digestive enzymes, and if those aren't working, then your body cannot properly digest things, and then it's just a whole big mess. So, stress hormones are really, really important, and if you have too many of them, they can prevent your digestive enzymes from working, and that's really not good at all. And those stress hormones are caused by an increase in anxiety. So, living with type 2 diabetes can be stressful for the individual and for those around them. Like I mentioned, my stepfather has type 2 diabetes, and I know that that's something that's really stressful for my mom. She personally sits out his medications every morning and every night. She tries to make dinner that will fit his diet, and she just also gets kind of stressed out when his blood sugar is really high, or his medicine isn't working, or he's really sick one day. So, living with type 2 diabetes can be stressful for those that live around an individual with type 2 diabetes. So, how does anxiety impact type 2 diabetes? Anxiety can lower or increase an individual's blood sugar levels, which I just mentioned. Someone with type 2 diabetes has to constantly monitor their blood sugar levels, their weight, and the diet that they live by. A study by Martino found that type 2 diabetes can cause distress because people are required to monitor their own disease and measure their own blood glucose levels. So, distress is negative stress, and eustress is good stress. So, type 2 diabetes can cause bad stress because people have to monitor their own blood sugar levels. Sure, you'll go to the doctor to make sure that everything is good, your diabetes isn't any worse off than it was, and your anxiety isn't any worse. But every day, the person with diabetes has to monitor their own blood glucose levels. So, lifetime anxiety in type 2 diabetic adults is a risk factor for reductions in diabetic self care behaviors, poor glycemic control, stroke, mortality, and other diabetes related complications. So, that could be something with your eyes, your heart, your nerves, blood vessels in your heart. Overall, anxiety can cause an individual with type 2 diabetes to have a poorer quality of life and overall a poorer outlook on life. How to manage anxiety and type 2 diabetes. Individuals can use cognitive behavioral therapy to alter how they manage their type 2 diabetes and anxiety. I saw this in one of the research articles that I read, and I thought it was really interesting. Um, this kind of this gave me 5 or so steps that someone can walk through to alter their anxiety around their type 2 diabetes. I did include a chart on the next slide that we can look at after this, but the 5 main steps are: first, to ask yourself what the situation or the event is, and then to think about what thoughts are running through your head, like what are you telling yourself about the situation, and then you're supposed to think about what is happening in your body and what can you do about it, and then you should challenge your thoughts, like, okay, this is happening, but is this actually happening? Or this is happening, can I fix it? And then the final step is to develop an alternative balanced thought. Another study identified Levinthal's self regulatory model as being key to helping people manage their anxiety and type 2 diabetes. I know we talked about this in class, so I thought it was really interesting that the study included this as a really good strategy to cope with anxiety and type 2 diabetes. This is kind of the relationship between doctors and patients talking about the illness and why a person thinks the way they do, and sort of just like altering the way that they think and helping them cope and come to terms with everything and find treatments that work. And then another study found that there are several methods to try and cope with anxiety during the day to prevent its impact on their type 2 diabetes. And so some of those were: have a worry time. And this would be when you sit down and you think about what is causing you anxiety, like why are you stressed? And then you should rate your worries on a scale from 1 to 3. 1 being something that you can absolutely fix on your own, and 3 being something that you can't necessarily fix. And then you should really work hard to tackle the worries that you ranked with a 1, and then find help to tackle the worries that you ranked with a 3. Other strategies were distractions, like go outside, go for a walk, or put on your favorite show, or read a good book. Other things were learning how to relax, train yourself to relax, learn how to relax your body, how to relax your mind, and then controlled breathing. So, really focus on breathing, getting in good air, letting out air, and just kind of relaxing your muscles. And then the last one was imagery. So think of relaxing memories or relaxing images. Like I know a lot of people think about the beach when they just want to calm down. So that's one strategy that they mentioned. This is the chart that I was talking about. So on the left, it has the steps that I listed out, and then just some examples. And then on the right, you can write down your experience, and it really helps the person walk through what they're thinking and kind of how they can challenge those thoughts. Okay, so in conclusion, anxiety and type 2 diabetes have a highly comorbid relationship. Anxiety can impact an individual living with type 2 diabetes in many ways, ranging from diabetic self care behaviors to even death. Anxiety can also impact the lives of those around someone living with type 2 diabetes. Like I mentioned, my mom, and how she goes out of her way to make sure that my stepfather has the medicine that he needs and that his diet is to a T of what the doctor recommended, and that sometimes she gets stressed out when he's sick or he's stressed. And it's a really great relationship that they have. Um, There are many ways to manage anxiety when living with type 2 diabetes. So, like I just mentioned, CBT or stress management tactics. And then, lastly, it is just highly recommended that doctors and psychologists identify and address anxiety disorders in individuals living with type 2 diabetes so that they can offer interventions that may improve diabetic control. And then that's my resource page. Thank you.